people will come. I know that there's the NHSN training today too. And there's also, because I had this on my calendar, there's a CMS round forum or something like that for long-term care that people can participate on and like give feedback. So that's like 2 long-term care things that could be pulling people away. So I'm kind of curious to see if people come or not. It might be a pretty sparse attendance.
Yeah.
That's like 2 kind of important things that they'll want to be a part of the CMS thing, and they'd want to be a part of the NHSN training, so.
You said you were unable to pull up that quick guide on UTIs.
Were you able to get it?
No, it's not even
Yeah.
letting me open it. I think there might be something wrong with the site.
Okay, I didn't know if it was just me. I was trying to search for things. Connie would have it. You could maybe send her a message and ask her to send it to you because she was the one that developed it. So she's been kind of like sad that not that many people have looked at it yet. So I figured this is just another chance to kind of promote it a little bit.
Yeah,
She might have it.
I have a saved copy.
Oh,
But
okay.
I don't know if that link's gonna work,
I
but
know.
we can try.
Yeah.
Well, we're at the top of the hour, so let's begin. Hello, everyone. Thank you for attending the Conversations That Promote Vaccine Confidence session today. My name is Zilly, and I'm an improvement advisor at Comagine Health. Before we begin, let's go through some brief housekeeping items. First, please keep yourselves on mute. If you have joined us through your computer system and you're not already muted, there should be a microphone icon. You can click to mute yourselves on the bottom left-hand corner of the screen. If you have joined us by phone, you can dial *6 to mute. You can also dial *6 to unmute yourselves. If you have any questions throughout the session, please place them in chat, and we will either answer them directly in chat, or Shannon, our presenter, or another team member will answer them during the Q&A section of the presentation. This session is being recorded, and the video and presentation will be shared when they become available. And finally, if you can please type in your name and the names of any other team members that are on the call with you, along with the facility you are from, we would immensely appreciate it. And with that, I will hand it over to Shannon Feingood to begin the presentation.
Thank you, Lily. Welcome to our weekly webinar series. I'm Shannon Feingood, a Senior Improvement Advisor at Comagine Health and the Washington State Lead. I worked in skilled nursing facilities for over 7 years, and I know it can be difficult to continue to have these conversations with patients and residents with so many other issues vying for your attention. We hope you'll find this guide to be helpful in creating new opportunities for conversations that promote vaccine confidence. Let's see, next slide. Okay, a little background of where this idea originated. In speaking with centers across the region, we found a common theme. Administrators, directors of nursing, and infection preventionists were telling us over and over that they are offering the vaccine and booster, but residents and patients say no, and that's it, done. We have heard from a few facilities who are trying to increase the frequency of engagement to see if it did in fact increase vaccine uptake. What they found was that they can increase the booster rates by increasing the frequency of engagement. It's not a quick fix, but at this stage of the pandemic, it seems like one of the only ways we will increase booster rates is one patient at a time, using creative and adaptive modes of engagement and education. Not only do centers heal and care for patients and loved ones, but you also have this amazing opportunity to protect this vulnerable population as they discharge to the community. In my experience as in a SNF, I know these conversations can be challenging due to the complexity of the patients and residents themselves, combined with how they are feeling in the moment, possibly just recovering from COVID, previous vaccine side effects, as well as any misinformation they may have been exposed to. Some things to have in mind while reading and using the guide. Remind the patients that this is an opportunity for them to get vaccinated in the facility where there are doctors and nurses present to monitor potential side effects and rest if needed in a supervised environment. This was created as a supplement to other vaccine and booster efforts. It's vital to keep our vaccine and booster toolboxes full due to the evolving nature of the pandemic. Feedback from other centers has taught us that engagement at both admit and discharge, and possibly along the way as well, results in the best outcomes. To be sure that the guide was both patient family friendly and accessible, we had it vetted with the Patient Family Advisory Council before publication. Ta-da, here it is. This is the first section of it. We are hoping that you find this guide to be useful for increasing vaccine uptake through increasing the frequency of engagement. We created these scripts with short stay residents and patients in mind, but you could easily adapt them to whatever your individual needs are. We've heard from several COVID positive designated buildings that they are reluctant to even offer the vaccine. So we created a script catered to that patient population as an option for initiating vaccine conversations. We continued from there to create a script for patients in non-COVID units, as well as a script for patients who are initially very hesitant around the subject of COVID vaccination. So I'll go through the sample script for the patients in the COVID positive facility. So when the person comes in, just as part of your admission process, you could say, it is standard practice at this facility to administer a COVID-19 vaccination to all eligible patients once their symptoms have subsided and CDC criteria have been met. I'm sure you are eager to avoid repeating this experience, and we would like to assist you in meeting that goal. Is it okay to get your consent now? We will return when it's safe to administer the vaccine. You hand the patient the consent form. We're so grateful for your cooperation in reducing rehospitalization due to COVID-19. And then at discharge, you come back around, but not on discharge day. It'd have to be within a couple days of discharge. Hello, I'm so happy that you're getting ready to go home. I have the vaccine you consented to when you arrived. We are glad that you can get your vaccine here where we can monitor your side effects. Our goal is to do everything we can to prevent rehospitalization due to COVID and help you continue your life without the worry of going back to the hospital because of this constantly changing virus. Thank you for your cooperation. So for example, as part of the admission process, you can include this sample script. It could be a page in the documents that the admission nurse goes through, and they could check a box or something similar so that you know it has been completed. Let's see. And I don't know how many people, does anybody have any questions about this? I know it's kind of a new resource. If you have any concerns even, I would be happy to address those if there's anything that like stands out to you about this right away. Anybody? All right, now I'm going to keep talking. So the highlights for the script and things to keep in mind if you want to reimagine it based on your center's population are a patient's disposition changes often, and when you increase the frequency of engagement, you greatly increase the likelihood of vaccine uptake. Some words that resonate with patients well are convenience of being in a supervised environment, no appointment necessary, and reducing rehospitalization. Something else that can be helpful when integrating this process into admission and discharge is having an easy to read booster vaccine fact sheet to hand them. Comagine actually has a great visual resource for boosters, and we will put some other resources that we have in the chat. Many patients have visual or hearing limitations and are recovering from various illnesses and injuries and have had so much medical jargon thrown at them. They might feel out of control of their own medical care, so it's important to meet them where they are and offer information that is appropriate to their circumstances. If you know that English is not their first language, you can have a sheet already printed in their primary language so that they can easily have that as an accurate reference. Since the patients arrive with the center staff knowing very little about their prior living situation, it will be helpful to have accurate information ready to offer. As we go through the scripts, which they're very similar, the COVID vaccine designated and not designated are pretty much the same. But I want to highlight the short stay residents who are hesitant to get the vaccine. I know this encompasses many of the patients that come into the centers. This script may fit your population a little better if you find most of the patients who come in are very hesitant to get vaccinated. So this is what we suggested is at this facility, it is standard practice to administer COVID-19 vaccines and boosters to all eligible patients while they are here. We find it is helpful to administer in-house so we are better able to monitor any side effects and eliminate barriers to vaccine access. Our next clinic or available booster date is X. Is it okay if we sign you up? We're happy to answer any questions you may have. And then reiterate the messages focused on convenience and accurate, up-to-date guidance from verified sources. Listen with empathy and validate concerns. And probably the most important part is listen with empathy and validate concerns. It's been proven over and over through studies and anecdotal information that when a person listens and validates concerns, a trust is built, which leads to increased cooperation in all aspects of care while the patient is at the center. I'm sure we've all been there. If you just listen for a minute and the patient feels like their concerns are validated, then they're so much more likely to cooperate in all aspects of their stay at your facility. Another issue that has commonly come up during our conversations with centers is that patients arrive having been exposed to a lot of misinformation from one source or another. Due to all of the misinformation out in the world today, it's important that after listening and validating their concerns, we emphasize that you are giving the patient what you feel is the most accurate and appropriate information for decision making. Often to answer any questions they have, offer to answer any questions they have and offer any follow-up information they would like. So the main points of that would be listen, validate, and offer accurate information. I am still surprised by some of the vaccine conspiracies I hear when I am speaking with friends and family. I'm sure everybody else has the same. We also wanted to include a few other opportunities for increasing the frequency of engagement. Activity directors can add the center's COVID information into the newsletter. It really helps with the community feel and connection to offer specific information about what is happening in your center's community. For example, the center I worked in would include information such as COVID testing day today. We had no new positive cases today. We had one new positive. We are going to be on quarantine for X amount of days. We're in outbreak mode for X amount of days. Please visit with family in designated areas, keep masks on. The residents and patients felt much more comfortable when they knew what was going on. Offering a snapshot of what has happened at your center during an outbreak and highlighting it regularly can put the idea of a vaccine or booster right in the forefront of the patients and residents' thoughts. If they know, but then also remember, because sometimes, people forget or they have a short-term memory loss. They know that when their center had a COVID outbreak, X amount of people went to the hospital, X amount died, X amount were very ill, and how vaccines and boosters may have contributed to a more mild illness during their COVID time. Direct the residents to informed leaders. So we found that when the same person is asking them over and over, a lot of the time, the patients and residents are just like, they see that person and they're like, no. So this could be a trusted nurse, CNA, activity director, chaplain. Emphasize to all of the staff that vaccinating and boosting is a team effort and offer kudos to staff who have these conversations with patients and residents. Have an easy to read flyer available for anybody to grab at any time. And it's just, easy access and to give to the patients and residents if they are asking some questions. You could also host a coffee and chat series. These are always really nice for people who have family members who have questions as well. They can invite their family members, or, the activity director can lead this. And we have found that these Ask Your Internist videos from the American College of Physicians are really, really great. They're 1 to 4 minutes long, and they have multiple languages, they address multiple issues, and they have just a wide variety of videos. So you could play the video, and then you could have the residents and patients chat with a trusted leader following the videos. And that way it's another opportunity for engagement and to answer questions and things like that. Another thing that is important is that most patients have been exposed to misinformation, so just continue to answer those questions. Um, Another idea that has been helpful is to have the family members attend the vaccination clinics with the patients and residents. Patients and residents may feel nervous to get the vaccine by themselves. They may want somebody with them. So you could have have some prizes or a raffle and have buddy boosters, and they could have names for teams and just kind of jazz it up and make it exciting. Encourage your team to regularly um, Encourage your team regularly. Make sure that they know that this is a team effort and that we are working together to protect these vulnerable, people and vulnerable population, and that we want to keep them safe and prevent them going to the hospital. And take time to emphasize successes. Initiate a trial period where you track how many vaccines and boosters without the guide, and then after a 2 to 3 week trial with the guide. Calculate if increasing the frequency of conversations truly does increase vaccine uptake. And then feel free to report back to us, and we may feature your story in one of our newsletters or at an open office hours. Um, it's important to practice cultural humility. There's many resources out there available to guide you in this. Every patient arrives with a unique background and experience, and it's important for staff to acknowledge and not dismiss this. Many patients have a mistrust of the medical community due to a long history of mistreatment. It's also important to offer vaccine resources in the primary language of the patient. I know some Spanish enough to get by, but if somebody offered me a flyer with a bunch of medical jargon in Spanish and then asked me to sign a consent, I would be very scared and confused. So, and I work in the medical field, so that would be, I still could not figure that out if I was presented with that. We are putting resources into the chat that have many languages and guidance on speaking with patients with diverse cultural backgrounds. Here we have a Jazzy QR code and link to our guide. And even though we had spread it across several slides, it's actually just a front and back of a sheet. And you can feel free, you can copy and paste and create something that fits your needs. It doesn't have to be, word for word what we just kind of put together something that we thought would work based on feedback and conversations that we've had. So I wanted to let you know that we are here to help. In terms of vaccines and boosters, we'll call your pharmacy partner and negotiate a schedule that fits your needs. We will call county resources and mobile clinics and help you to get the resource that you need for what you are dealing with in your center. We will get that going for you, and we can help with follow-up and all of that. We know that a huge issue right now is vaccinating short stay patients, and that many pharmacy partners often require a minimum of 6 patients to visit and vaccinate. So like they're like, we're not coming if you don't have 6. And this does not work if you only have 2 for the week and one of them is leaving at the end of the week. So we'll help you with these issues and more. And we know that your time is valuable and there's so many things vying for your time. So we want to help make this a little bit easier. Currently, vaccines and boosters are CMS's top priority, but please feel free to reach out and let us know if you need assistance with anything else. We know that with COVID outbreaks kind of settling down a bit, many centers are beginning to focus on their priorities that they had before COVID. We actually have an excellent new UTI quick guide and many, many other resources to assist you. And we are contracted through CMS, so our services are free of charge and we are here for you. We would love to, help you and ease your way. And we also want to make sure that people know about our open office hours. So this is a great opportunity to speak with your peers, share what works and what doesn't, review best practices. We usually begin with a short presentation on any guidance updates or stories from the field, and then offer a discussion following. It's just a great time to kind of, reflect on what's been going on and what you found that works for you and find out other ideas from other centers. It's a great opportunity. So here is our contact information. So we have a lead for each state that we serve. Um, Connie is our Idaho lead, Donna for Nevada, Andy for New Mexico, Lisa for Oregon, Adrian for Utah, me for Washington. And we also have a NHSN resident expert, Lisa Barton. If you are having any troubles with NHSN reporting, please reach out to her. She's got so much experience helping centers with this, and it is really her specialty. She attends all of the trainings and updates, and so she is really up on what is going on with that. So please, please, please contact her. And that is the end of my presentation portion. I would love if there's any questions. Let's see who's on here. Anybody, please ask me questions about this, or maybe even just share some experiences that have worked for you when you've like practiced to increase your communication with patients and residents, because I think it's just really important to know what works. I mean, we share this guide, but you are there in the field and you know what works the best. So please let me know if there's any questions. Is there any questions in chat, Lily?
There are none that I see, but for those that are on the phone that want to ask a question, you can dial *6 to unmute yourselves.
Yes, please ask me a question. I am happy, or give me feedback. Even if you're like, this guide, I don't think it's gonna work. Let me know. I mean, I'm happy to continue to modify and.
I just wanted to make a statement, I guess. It's Marisol.
Okay.
Like most of the staff, I think they have like a misunderstanding that if they get the vaccine, they're not going to get COVID. And I feel like there's a lot of education that they need to understand, because they see like other people that got the vaccine and they're like, well, they got COVID, so what's the point of me, getting vaccinated? And so I feel like there's a lot of, or maybe not enough education, that it's not really that you're not going to get COVID. It's more that it keeps you out of the hospital for it to become severe.
Yeah,
I think that a lot in my staff, like they question that a lot.
Yeah, I would imagine, because I mean, you get all this anecdotal information from your friends and family, and yeah, so that's kind of why when we were working on the guide, we wanted to try to focus a little bit on, like, we just don't want you to go back to the hospital. It doesn't mean you won't get COVID. So we can also look to put some resources. We can also do a follow-up email with some resources just on educating the staff as well, and just what happens is. And would you say that having the resources in any other language would be helpful, or anything like that? Because we can also link to some of those types of resources that might be helpful.
The language thing is more like for the community.
Okay.
Employees that work for a healthcare facility, they're required to know fully English. And,
yeah. So maybe we can have some resources that are helpful for the staff to just understand what the reasoning is behind getting a booster and protecting both themselves and the residents and patients from getting and going into the hospital. Do you think that would be a little bit helpful?
Yeah.
Okay. All right. We can definitely do that. We can get that to you. Otherwise, do you think that the guide would be something that you might use?
You can send it to me and I can share it with my infection control nurse too.
Yeah. Okay, that sounds good. And then we have a poll that we are going to put up. Do you have that, Lily? We were just going to ask if you guys think you might find this as something useful for you to use, in your centers. And like I said, it's something that you can modify based on your specific needs. It was more like a generalized, and the intention was a lot around just increasing that frequency and opportunities, because as we all know, the patients and residents, a lot of the time, one day they're happy, one day they're not. In the morning they're feeling terrible. In the afternoon, they're feeling great, you know. So just increasing those opportunities is sometimes all that it takes, you know. So does anybody else have a question or a statement or anything? We're happy, like I said, we have lots of resources, and so we're happy to save you from having to peruse around the internet and try to find the thing that fits your needs the best.
Would you like me to end the poll, Shannon?
Yes, please. Thank you, Lily. Okay. Looks like this people found that this content was relevant to your work. Do you have further suggestions, anybody, like of what we could do to further enhance communication with your staff, residents, patients? Leanne, Lori, Tatiana, Cher, anybody?
Hi, Shannon. This is Joanne from the Department of
Oh,
Health.
hi, Joanne.
Hi, I was listening in today. I was actually
Yay.
able to leap onto the meeting. I was so glad. I often have a conflict.
Yeah.
So anyway, I just wanted to say thank you for providing the opportunity to talk about this with people, and also for providing some scripts and
Yeah.
ideas for
Yeah.
checkbacks. And I think I just wanted to support the work by popping on to say, we really agree that we're finding that there really is no magic bullet, no silver tool to make this happen. It's really discussions, person to person, one person at a time, you know,
Yep.
really understanding and listening to people and finding out what their needs are and concerns are, and then finding ways to meet them. So thank you.
Oh,
Really
thanks, Joanne.
appreciate it.
Yeah, that's really what we found too. The more we've talked to centers, the more we've realized it's very individualized, and that, you know, it is really a one-on-one conversation if we're going to really try to get, you know, these vulnerable people vaccinated, especially the people that didn't get it in the initial run, you know. And so
Yeah.
we just think it's really, and so
Well,
that's, we're here to
that's a
help.
really valid point too that you just brought up, because I was thinking the same thing, Shannon, which is, look, if you know, approximately 80% of the population is already vaccinated, then there's only 20% left. So it's not to say that, you know, it's easy work, because yes, it is harder, and it's harder to, you know, reach these folks who need more support, but it's equally as important. So just really appreciate all the effort and the check back and the review by staff at facilities to continue trying to help people get vaccinated. Thank you.
Thanks, Joanne. Yeah, that is really just the goal, is to get to that endpoint where everybody's safe and protected, and, you know, keeping people out of the hospitals. That's really it. So does anybody have any further questions or discussion? All right, well then we can wrap it up, and we really appreciate, this is recorded, and we are going to send out some follow-up information to everybody. So thank you for attending, and we really appreciate it, and we hope that this guide is helpful to you and your center. Thank you so much.